Hello, my name is Licia Ruiz. I'm the nurse of the staff nurses in HCA Brandon Hospital Med-Surg for 4 years, and my tower is D3. I was in a hospice admission nurse and PCU nurse from a long-term hospital, and I will introduce the strategy leadership brief that help a nurse leader assess the capacity for change within a unit. Three primary aspects we need to contemplate: safety, effectiveness, and patient-centeredness. Poor communication can cause delays in responding to patient requests for assistance, for example, false or medical errors, which can cause poor quality care. It is essential for the team to be on the same page to be ready to confront any issues, such as knowing the protocol or the operational flow of the floor where we work, and working with the same team who are familiar with each other. Thus, will help us as a team overcome the weakness of the, for example, communication barriers such as accents, slang, and limited vocabulary. Since most of the team members come from diverse cultural backgrounds and countries, especially in Florida. The SWOT analysis divides internal and external positive and negative objectives to work on the issues, finding solutions that the nurse leaders may focus on, such as huddles, training, technology use, but also looking for external resources, such as workshops. For example, American Nurse Association provide workshops and guidelines focused on nurses' communication skills, social media, as well as like Instagram or Facebook. On the other hand, nurse leaders need to be aware of the adverse outcomes and find ways to mitigate them, such as communication styles, backgrounds, or barriers, or implementing new technology and protocols that developing difficulties in the communication or interaction flow. Clear and concise communication is essential to ensure that information is transferred accurately between team members. Communicating efficiently within their team helps against resistance to change, lack of the awareness, or different perception among staff related to safety measures. At the moment, HCA Brandon Hospital, Med-Surg Tower D3, nurses and all team members need to be aware that we had to keep our level of the patient care high, not because we have the excellent quality patient care reviews in the past, but because also our interdisciplinary teams, such as doctors, surgeons, residents, PT, OT, etc., have a highly trustworthy in D3 and its leadership team. Specifically, med-surgical D3 leaders need to focus on implementing financial bonus that help attract and retain nursing staff, as well as encourage long-term commitment to the medical floor. Because when the same staff bond with each other, they build a strong relationship where each healthcare team member used to communicate with people that they know already and when they feel like they belong as a team. Regular communication meetings, support by strong leadership, are the keys to enhance a culture of the transparency and collaboration within healthcare teams, respecting cultural backgrounds, and identify communication barriers. Moreover, training and workshops are beneficial programs that provide opportunities for nurses to engage in active learning, allowing them to practice effective communication techniques in real-world scenarios. Learning experience can help build a confidence among nurses, allow them to express their thoughts and concerns more openly. Investing in training programs focused on communication skills not only enhances nurses' ability to convey important information effectively, but also empowers them to engage with patients and colleagues, reducing the likelihood of the misunderstanding that can lead to errors. In summary, nurse leaders need to identify the issues, study the pros and cons, introduce the discussion to resolve the problem based on previous evidence, analyze the finding and recommendation, and take actions. Thank you very much for listening to this brief presentation.